We are live. Hello, everybody. Happy Friday. We are here with the wonderful Dr. Richard Baxter. Thank you so much for joining us today.
Thanks for having me.
So guys, today our topic is the problem may be a tongue tie. Dr. Richard Baxter is the founder and owner of the Alabama Tongue Tie Center. He's a nationally recognized speaker on tongue ties, instructor of the comprehensive course Tongue Tie Academy, and author of the best-selling book Tongue Tie: How a Tiny String Under the Tongue Impacts Nursing, Speech, Feeding, and More. He's a board-certified pediatric dentist, diplomate of the American Board of Laser Surgery, member of the American Academy of Pediatric Dentistry, the Alabama Dental Association, and the American Dental Association. Dr. Baxter attended the University of Alabama at Birmingham School of Dentistry, where he graduated at the top of his class. In order to receive a specialty certification in pediatric dentistry, Dr. Baxter attended the residency program at Nationwide Children's Hospital in Columbus, Ohio. Dr. Baxter enjoys spending time with his wife, Tara, who is a nurse practitioner, and his three girls, Hannah, Noelle, and Molly. And since he had a tongue tie himself, and all three of his daughters were treated for tongue and lip ties at birth, this field is a personal one. So would you tell our viewers a little bit more about how you found out you had your own tongue tie?
Yeah, basically after our girls were born, found I had a tongue tie, and when I was 30, I had it done and saw crazy results. So airway issues, it was easier to talk. I could talk longer, faster, more clearly. Yeah, it made a huge difference. So
perfect.
Anyway.
So we are here today. We have Ruth, our occupational therapist, and I see you're eating, so you don't have to talk. And we have Anne, our speech pathologist, and I'm Renata, I'm a dental hygienist, myofunctional therapist. Airway Circle is all about a multidisciplinary approach. So we like bringing other professionals. We're all together, helping each other out for the better outcome of our patients. So Dr. Baxter has prepared a presentation for us today, and we will open the floor for questions later. So if you guys have any questions, please send us on Facebook or right here on our Zoom call, and we will ask him later. So the floor is yours.
Perfect. All right, so we have a lot of slides, so I'll talk a little bit quickly, so I want to get as much action-packed as possible, but I'll try to save some room for questions, obviously, too. So a few disclosures. As Renata said, I am the owner of the Alabama Tongue Tie Center, coming to you live from today. I did write the book Tongue Tied. The team of specialists, we do receive royalties. Those are donated to charity. Have an advanced live patient course at our office that is also donated to charity, and the online course Tongue Tied Academy, and we have a light version for therapists as well, Tongue Tied Academy Light, also donated to charity. So don't have any interest in dental or laser companies, so just my own thoughts. So tongue tie has been translated into a few different languages. So Spanish, we have French, Polish is coming, and Danish. If you guys knew that was Danish or Polish, that's impressive. But anyway, if you guys do want to get a free copy of the English ebook, you can get it on our website at tonguetieal.com/professionals and download it for free. Here's Tongue Tied Academy. That's what we did during COVID. It was a week-long video shoot. I thought my jaw was going to break. I was talking too much, but it's 25 hours of video. The light version is 13 hours, but it's basically the A to Z of how to treat tongue ties. And there's my family. There's my wife, Tara, and here's Noelle. Here's Hannah. They're twins. That's how I got in this whole mess in the first place. And then there's Molly. She's 2.5, and the girls are 7. Unfortunately, Noelle broke her arm right after this picture was taken on those monkey bars right there. We ran a 5K, and the girls did like a 1-mile fun run. Ran really fast, and then she fell and broke her hand. So it's okay. This just happened last weekend. It'll be fine, but she's a trooper. Here's our office, briefly. So it's a pediatric dental office. That's the Tongue Tie Center we built on a few years ago. And so basically we talk to moms and see what's going on. We examine the baby. And then this is pre-COVID, but examine the baby and then treat when indicated. So that's what we're going to talk about today. So Rajiv Agarwal is a pediatrician in Arizona. He wrote the foreword to the book, and I had this quote in there. It said, "Your eyes do not see what your mind does not know, but once you've seen it, it's impossible to unsee." So like with airway issues, it's like, oh my gosh, like how did I not see these things before? These kids with the dark circles and large tonsils and their open mouth posture. But the tongue tie can also be a hidden reason why a lot of those things got started in the first place. So I spoke at the Children's Airway Conference back a couple years ago at the ADA, American Dental Association, and got to share for a couple hours about tongue ties and how it can impact airway. And there's a lot of overlap there. So you'll see a lot of things today that you've probably know already, but hopefully some good things you don't. So as Renata said, always with a team approach to care. That's point number one right there. Also, all proper diagnoses start with a proper history. So if you don't get a good, full, comprehensive history from the patient, you're not going to be able to really figure out what's going on. So misdiagnosis comes from not listening and not examining fully. So you always want to listen to mom's story without interrupting and empathize. Review all the symptoms systematically one by one. We take notes while we're doing that. Always examine properly. So you do have to put on gloves. You do need a tool like a mouth prop or something to get in there so you don't get bit by like the 2 or 3 year old. This one's really key. I'll say this probably 10 times today in an hour, but symptoms and function are more important than the appearance. Probably 3/4 of the patients that come to us, honestly, are not to the tip. They're posterior tongue ties, just means by 50% or less of the way to the tip. They're less obvious, causes terrible pain for mom, can cause speech delay, other airway issues, sleep issues, everything like that. It does not have to be to the tip. So we'll hear like, oh, this morning had 4 new babies, and all of them said, oh, my pediatrician said there's nothing there. There's no tongue tie. Well, that means it wasn't to the tip. It was, all of them were posterior tongue tie this morning. You have 6 this afternoon, so we'll see what those are, but probably more. So we do 10-ish a day normally. We take pictures of all the areas of concern. You'll see those today. Talk to the parents, make a plan. Often that's released the same day or later if they need therapy first, just depends. Most of what we do is babies and toddlers, but we do some adults. We do, all ages. So release fully. So that's key. And precisely if it's indicated, or, for you guys, refer to a knowledgeable provider in your area or as close as you can find. Follow-up is really key too, because often it will have grown back a little bit. And so we'll do a deeper stretch if needed. And also, if you don't get them back for follow-up, you don't know if it improved or not. So how do you check a baby? It's pretty much the same as an adult or any age, really. You're going to come from behind, use 2 hands, put on some gloves. We like this special knee-to-knee lap board. It's from a specialized care company. They're around $100. On our website, there's also like a download all our forms and has a list of all the materials we use. So it's all for free. But anyway, this is a child. You can check the same way, but it's also hard to get in there. So you really need like that mouth prop right here. You can get those on eBay for about $5 at 3.5-inch molt mouth gag or mouth prop. And we actually send those home with the parents. If it's like a 2-year-old, like we had a 2-year-old this morning, sent him home with the mouth prop because otherwise they're not going to be able to get in there to do the stretches properly. So basically, it's more appreciated as a spectrum of lip restriction than just like class 1, 2, 3, 4. So because it's, different thicknesses, different tension on it. Sometimes it's notching the bone like this one. Sometimes they're real thick and corded. Sometimes they're really thin. And but the key is it blanching? Is causing the child distress when you're lifting up on it? Is it impacting function? Are they having seal issues if they're breastfeeding? Anyone says there's no such thing as a tongue tie. I show them this one on the bottom here. That's unbelievable. Like that's so tight. That's the tightest we've ever seen. I saw one that was close to that a couple of weeks ago. I gave him a gold medal for the second tightest one. I didn't have any silver medals, but anyway. So this one up here on the upper left, this is basically the smallest one I've ever seen. That is not a lip tie. That's fine. It comes down all the way, right? This one also comes down pretty far, but if it's not causing symptoms, there's nothing to do. But if it is causing symptoms, even if it's real thin, that could still cause a whole lot of problems for mom and baby. And as they get older, you can imagine they'll have a gap in the teeth. They can have trouble brushing their teeth, as we'll see in just a second. So tongue ties, this is probably one of the thickest ones I've ever seen in a baby. Real thick, can't move their tongue at all. These ones are pretty common. One of the babies had these yesterday, just like that. So it's close to the tip. Sometimes they're really thin. You can see through that one practically. This one's been clipped previously. So when they clip it, often they just get part of it. They don't get the whole thing. This one also is clipped previously. Look how thick those are. Those are super thick. So you can imagine this tongue cannot lift up very highly. Neither can this one. So those babies cannot get the full range of motion. Like your shoelaces, they're not tied all the way together, but they're tied, very tight as well. So you're still gonna have trouble. What's really interesting is that the posterior tongue ties, like these on the bottom, those ones typically cause more pain for mom, okay? Those cause terrible pain for mom. And it's unfortunate because those ones are not picked up. So the pediatrician, like, oh yeah, it's fine. There's no tongue tie because they're saying it's not like this one on the upper left. That's like the only ones they look for, like these ones. But unfortunately, also we see parents come in and it's to the tip, and they still said, "Oh, it'll stretch out. Don't worry, it'll go away on its own." They do not stretch out. They don't go away. They can cause problems for the lifetime of that patient. Much better off to take care of it as soon as possible as a baby, or just as soon as it's identified. So, all the posterior tongue tie can cause the same problems as an anterior tongue tie. Also, you have to challenge it. You have to lift the tongue up, or else if you just peek in there with the tongue depressor, like the pediatrician, not to brag on pediatricians, we love our pediatricians, but in general, they'll just peek in there with the tongue depressor. ENTs might too, no gloves on. They're not like lifting it with two fingers, and they'll look in there and say, "Oh, there's nothing wrong." You lift up with one finger, notice the fascia start to bunch together there. So you see it's bunching up. Lift with two fingers now. You see it's much tighter. So this is the same patient, just lifting up with different amounts. You can see how much more visible it is. Same thing on this child. This is a patient we saw on a hygiene check. They did not come see us for tongue tie reason. They have a fused tooth on the bottom. So it's like a hygienist or a dentist, like, oh, there's a fused tooth down there, and no are fused. But really more than that, like, okay, let's check the tongue mobility. Okay, he cannot lift up very well. He probably has 50% mobility. Hey, mom, any speech, eating, or sleeping issues? Nope, Johnny's good. Well, then there's nothing to do. So don't treat it, right? If it ain't broke, don't fix it. But if you did have lots of issues, then maybe it would be worth fixing it, because it's about a 10-second procedure, as we'll see later. So in children, again, symptoms and function are more important than appearance. I don't really even care what it looks like as much as how it feels, but also how impacted they are with their sleeping, eating, speech, airway concerns, all that stuff. So this one on the left to the tip can barely lift it up, and had perfect articulation, right? This one on the right, they can lift up really well, grade 1 mobility, so greater than 80% mobility. But you'll notice they're lifting the floor of the mouth a lot too, so they're compensating. And so this patient right here was nonverbal, right? He was autistic, but we treated him and he came back talking the next week. He had several new words the next week. And he was like 9 years old. And so that's what's crazy. This one right here, terrible neck tension, headaches, all that stuff. This is a 6-year-old. Notice they're just getting that tooth in. This is probably like a 2 or 3-year-old, but still really restricted mobility. So elevation is the key, and then protrusion is not as important. So a lot of kids can stick their tongue out. We still treat them, and they still have crazy results because they can't elevate their tongue, specifically the back of their tongue. For lip ties, can cause cavities or can lead to difficulty with brushing, which leads to cavities, can trap milk or other food up there. It's not cosmetic. You got a dog leg on this one. It's blanching, so it hurts the child when they lift up on it. It's not cosmetic. I have a slide at the end of the intake. We have time, but I can show you about 94.5% of the time in the research at our office, we're working on getting that published, the gap closes up somewhat or all the way. So it does not leave scar tissue. You don't have to worry about that. Treating it early is not going to leave scar tissue. Closes up beautifully. So here's our assessment form. So we've looked at like how to visually look at it, but what are the symptoms they may have? I'll zoom in here. So this is adapted from Dr. Kotlow. He came up with the first version of this form. We've modified it a little bit. But basically, this is our latest version. So if you have an older version of this form, like past a couple, 1 or 2 months ago, this is the latest version. I was real sneaky with this one, right? What we did was I put all the tongue tie things on the left and all the lip tie stuff on the right. And it's not perfect, but in general, these are more lip tie stuff. Lip curls under, clicking or smacking, sucking blisters, colicky, reflux, spitting up, gassy, milk leaking out, nose sounds congested. Those are all more lip tie symptoms. The tongue tie stuff is more the shallow latch, falling asleep, sliding off and on, gagging, poor weight gain, hiccuping, gumming or chewing, passy falling out, snoring, short sleeping, baby moves a lot and seems always hungry, not full. So those are more tongue tie stuff, right? So if they come in and they checked both sides, probably lip and tongue tie. If they come in and they just checked one side, probably a lip tie, probably a tongue tie, or vice versa. So that's kind of helpful. People will come in. Almost always it's like, okay, Johnny has the lip tie. I see the lip tie. The doctor saw the lip tie, but they'll have checked both sides, right? And so I'm like, well, he probably has both. And so if we just treated lip tie, we'd probably see these resolve. If we just treated the tongue tie, we'd probably see these resolved. If you do both, you get some synergy. It works together. Another factor too is this one right here. So for the pediatricians, other people, typically that's the one check mark they care about. That one is an important check mark because we had like a 15-month-old that was only 13 pounds yesterday. That's not enough. That's really small. We had an 11-month-old that was like 10 pounds. I mean, again, not enough. Those babies have significant failure to thrive, having significant, issues, brain growth and other growth and development. So it can be important, but we have a lot of people come in, they check every mark except for that one. And the pediatrician says, oh, it's fine, they're gaining weight. And mom has like 7 out of 10 pain, which again, if it's real bad like that, it's probably a posterior tongue tie, if it's toe curling pain. Occasionally it'll be anterior, but most of the time it's posterior. So for children, this is our form. So we'll zoom in again. Typically, it's 3 main domains: speech, feeding, and sleep. They can have some lip tie issues. We just added that one on if you have an older version of this form. Adults will typically have the sleep stuff and then the other stuff. And then we want to know about their history as a baby. So whatever they had as a baby is right here. We have a new adult form that takes out the baby one because when they're 40, they don't realize, they don't remember if they were gassy when they were a baby or something. So, but most of the time, this is for like 2-year-olds up to about like teenagers. We'll do this form. So this is the most common things we see. I'll try to run through this briefly, but basically with speech, they have a hard time being understood. They might be shy, trouble getting words out. Speech delay is a big one we see a lot. Stuttering, have some crazy results from that. Often adults will still mumble or baby talk. Eating, they'll eat really slowly, small appetite. They'll pack food in their cheeks. They're a picky eater. Choking or gagging on foods or liquids. Spit out foods, trouble trying new foods. Those are all red flags, right? If a child just comes in, they're just picky eater and like a couple other things, maybe not a tongue tie. But all these here are all tongue issues. The lip tie is only right here, right? These are all tongue tie issues. So it really makes a difference. Again, people they'll come in for the lip tie and they'll check off like a bunch of them on the tongue tie stuff. And he probably is likely having some tongue tie issues too. Sleep issues, you guys will be familiar with these because these are also airway issues. But if they sleep in weird positions like tripoding, they sleep restlessly, they're moving around everywhere, they wake up easily or often wet the bed still and they're 6 years old. They wake up tired, not refreshed, have brain fog if they're an adult. They grind their teeth, that's a red flag. They're having physiologic stress, sleep their mouth open, they're snoring, gasping for air. All these are red flags, right? These are not good. We do not want those. And then when we move to the adult one here, so this is the adult assessment. And you can download all these from our website. Speech issues, we changed them a little bit, like shy in social situations, embarrassed. The jaw gets tired when talking or reading out loud. Kids will too, but they may not realize it. Choking or gagging on food or water. These are all basically things, the way we came up with these forms. This is things that got better after we treated their tongue tie, right? So these are things that we see pretty consistently improve, like, oh, I don't need my sleep appliance as much, or I don't grind my teeth as much, or I don't gasp for air or move around as much. Someone came in, had trouble kissing. So like we see all kinds of stuff. Don't hold chiropractic adjustments well. Even constipation can be related. I mean, it's so many things. And then breathing issues also. We added this on there for adults mostly, but it's also for kids. Teeth extracted for braces, jaw surgery in the past, like I had, sinus issues or sinus surgery, like I had, tonsils or adenoids out, mouth breathing, like I used to do. And I wondered why my lips are always chapped, even in the summertime, because I was mouth breathing and had a tongue tie. So are you just going to treat everyone? No, we need to figure out, how to do this and implement it into a busy practice. Because everyone here is busy. You're busy with hygiene checks or well-child checks if you're a pediatrician. But anyway, quick and easy to implement, combine symptoms, function, and parents' desires is critical. We want to predict if it's going to help. And then we also definitely want to prevent treating if there's no issues. Again, we never want to over-treat, but we also don't want to under-treat. And very often the tongue is a precipitating factor for why they have these airway issues later. So we're going to use the TR-MR tongue range of motion ratio from Drs. Yoon and Zaghi. Basically, if you lift it to 80%, that's a grade 1. 50 to 80%, grade 2, less than 50%, grade 3, and grade 4, barely lifted up, that's less than 25%. Basically, if you can lift less than 50%, you're in the bottom 10%. Normal value would be like, 51 to 77%. That's like one standard deviation. But really what's interesting is even some kids that have like this grade 2, they're cheating. They're lifting up with the floor of the mouth right here. So if you put a finger there and hold it down, there you'll see their true mobility. So again, sticking out your tongue is the worst test, but what I say, symptoms and function are more important than the appearance. So Here's our TRQ. Again, you can download it on our website. Here's the baby issues at first, and then child issues here. This is our first version of it. We changed it a little bit and revised it. So here's the revised version. Basically, this is the greatest hits of that previous form that had about 50 items. This is closer to 15 items. So if they have several check marks on here, it's probably worth getting them back for referral, either to like the tongue tie center or whoever you refer to. But this is really helpful because if they check off 3 things on here, let's see, is it speech delay, choking or gagging, grinds teeth, they probably wouldn't have jaw joint problems. That's more for adults. Mouth breathing during the day, that's significant. So we probably should look into that. How much they impact quality of life? Well, we can't talk, so that very significantly impacts quality of life. If it's not at all, well, then we're probably not going to send them because mom has no perceived need for treatment. And then the child can lift grade 2 or grade 3. Well, we definitely want to get them referred to get it evaluated. So this does not mean like, yes, we're going to treat it right away, but it's saying, hey, we want to have them fill out the whole 50-item questionnaire, dive in deeper than we can do on like a 5-minute hygiene check, because we also got to check the teeth and check everything else and talk about cavities. So we got this published in March in Compendium, Tongue Restriction Questionnaire. So you can download this on our website or on the Compendium website. But basically, this is the most common symptoms we saw. We had 300 kids we did this on, just on hygiene check. And so snoring was very common. About 30% of the kids, picky eating, restless sleep, mouth breathing, trouble with speech, teeth grinding, about 20% grind their teeth. So common does not mean normal. Just because they're grinding teeth, oh, all kids grind their teeth. Oh, all kids have picky eating. I mean, it's common. Cavities are common, but they're not normal. So then we looked at, okay, how many symptoms, how many check marks on that first form did they have to have on the first version of the TRQ to warrant a referral? So if they could lift greater than 80% and they had like 4 or 5 check marks, probably not going to send them. But if they had 10, all right, now it's probably worth like getting looked at, right? Because it's like, okay, every check mark and they can still lift up, there still may be an issue. Conversely, if they can barely lift their tongue, they don't have to have very many symptoms for it to be worthwhile. So they like even 4 check marks, we're like, yeah, mom, I need to get this taken care of. A couple of different things here. Babies with symptoms who are left untreated are more likely to have higher symptom counts as children, which is highly significant, more likely to be referred for treatment later on if they had issues as a baby. So we really need to check our babies if they have issues with breastfeeding, bottle feeding, colicky, gassy, fussy, all those things. Also, 26% of the patients, the parents thought the referral would be helpful. They're like, yeah, I do want to talk about that more. So it was like a quarter of the patients just on our normal hygiene. And that number is probably actually low because we've already taken a bunch of our patients and screened them and done their tongue ties. So these are patients that we had not treated, obviously, prior. So yeah, we should really check at all hygiene visits or the medical doctor, whatever, because it's very high, much higher than currently thought. So we kind of hit this already, speech issues. It's in the Bible, even Mark 7:35. His ears were opened, the string of his tongue was released. It's behind this, sorry. And he spoke plainly. So it's in the Bible. Trouble speaking clearly or quickly. They're shy. Feeding issues, we talked about these already on the other form, but they have lots of trouble eating. It's very hard for them to go out and eat a meal, hard for them to, have fun as a family. So it can affect quality of life a lot. But it had never been reported before 2018. This is the first article on feeding improvements and tongue tie. And at that, it was posterior tongue tie. So basically what we saw was treating these not obvious tongue ties here, they saw crazy results with speech and eating issues. This is just 5 patients, which is just a case series, just trying to get something out there because we were working on the book, and every chapter in every section in the book has a research part. I literally didn't have a single article to put in the feeding section. I'm like, this is crazy. So we got this published, and we put that in there. So anyway, it should be recognized as a spectrum of issues like autism or sleep apnea. It's not just, it's varying levels of elasticity, varying levels of where it inserts and thickness. And so it really we need a paradigm shift is what that says. As you know, it can cause lots of issues, even like embarrassment or bullying, poor growth and development, airway issues, so mouth breathing, poor oxygen, snoring, poor sleep quality then leads to poor behavior. I'm preaching the choir here. ADHD, which is often actually airway issues. They're not getting high quality sleep. I know I'm more scattered. I have a harder time behaving properly when I don't sleep well. Grinding their teeth, brain development. I mean, by the time I age 3, the brain is 80% the size of an adult brain. By the time I age 5, they're 90% the size of an adult brain. So it's so critical to get them early as possible. High arch palate. Again, the palate's the floor of the nasal cavity, so you push that up. You're not going to get a deviated septum, sinus issues like I had, tongue thrust, crowded teeth. Might need jaw surgery, and then reflux and constipation. So we did a study on this a couple years ago. It got published in Clinical Pediatrics. It was actually a pretty good journal in September 2020. So it was a prospective cohort study, meaning before we treated the patient, we enrolled them, said, you're in the study. We enrolled about 50, and then you lose some to follow up because they don't come back and see you or whatever. But we enrolled them in the study, said, whatever happens, we're going to report the results. Average age was 4.2. About half of them had posterior tongue tie. Half of them had a 50% or greater anterior tongue tie. Significantly better speech, feeding, and sleep at 1 week and 1 month. There was no difference in the anterior versus posterior tongue tie. They both saw good improvements. Speech delay, this is the first article to show a difference in speech delay, picky eating, slow eating, choking, snoring, and restless sleep. Here's a couple of charts or tables from that. So basically the way to read these, and you can go back and watch this later, or you can just download the article for free on our website. So 37 total. 18 of those 37 marked on that first form said, yes, my child does have frustration with communication. Of those, 15 out of the 18 improved. So that's a lot. So that was highly significant. But overall, 21 improved. That means 6 of them saw improvements, and they didn't realize that their child's frustration was related to the tongue tie. So they didn't mark it initially, but they saw more improvements too. It's like speech delay down here, right? 16 said, yes, my child has speech delay. 8 of those improved, so half of them, so not all, but I mean a good number of them, within like a week saw new words, right? But 5 others also saw new words and didn't even realize their child could talk more or better or whatever. So you see lots of highly significant results there. And even like the one like stuttering, right? It says not significant, but 10 kids actually had less stuttering afterward. Only 4 of them marked they had stuttering in the first place. Feeding, same thing, much better with slow eating, grazing throughout the day, picky eating, choking or gagging on foods, spitting out foods. I mean, some huge results there, 18, like in the teens of those kids. So it's not all the kids, but I mean, it's a good number of them. But see, not all of them had those issues in the first place, right? So like only 4 said, yeah, my child has frustration. But afterward, oh my gosh, 18 said he eats better, mealtime is more fun, whatever. Sleep issues, so airway things, lots of these were significant just after the tongue tie release, and then myofunctional exercises we gave them. This is only within like a week or a month, right? And so sleeping in weird positions, like sleeping with their bum up in the air or throwing their head back, like CPR position, kicking, moving at night, so restless sleeping. I mean, tons of them saw improvement. Sleeping deeper, I mean, it's almost all of them, right? 37 a total, 28 of them saw improvement. Sleep with their mouth open, 26 were, 22 saw improvement. Snoring, 20 saw improvement in snoring. So this is huge, and it's really underappreciated because right now, if you're snoring, they'll say, okay, get the tonsils out, get the adenoids out, maybe an expander, myofunctional therapy, obviously, but like no one even really thinks about the tongue tie. It can make a huge difference. So there's another paper we're going to work on with Dr. Zaghi as the Pediatric Sleep Questionnaire you guys are probably familiar with. So basically, if you score 0.33 or 7.5 out of the 22 questions on that, yes, it's been associated with OSA in children. So from our office, their baseline was 0.48. So like half the questions, yes. 1 week later, we're at 0.2. 1 month later at 0.14. So it's highly significant. This is 27 of those kids were old enough to do the PSQ. It starts like 22 months, I think. It's validated for, but anyway, it was measurable and lasting, and they had improved daytime symptoms too. So this is huge. So we're working on getting this published soon. Here's a graph showing that it was significant. So afterward, here's the numbers to hang your hat on. 89% improved speech, 83% improved feeding, 83% improved sleep, 90% were happy with it. Some were like, yeah, it was okay. The stretches suck, which I mean, the stretches do suck, but if your kid's eating better, sleeping better, it should be worth it at least. But anyway, so it's not all the kids, but it's the majority of them. I mean, if you look at taking tonsils out or other things, nothing has 100% success. So it's very high. It's likely, I feel like it's higher than that. If you combine it with therapy and with a team approach, you'll get darn near close to 100%. It might be 95%, but you got to do it right. So now we're going to talk about how to do it right. So a clip or a snip where you cut into the body of the tongue or don't take enough. These were clipped previously. So this one they cut in the body of the tongue, they just missed it. This is a kid in braces, so they were probably 13. Not sure what they did there. They didn't get hardly anything. There's when they left the lip tie. This one cut right here and cut right here somewhere. So that's not enough, obviously. With scissors, you got to get the whole thing out. You got to get this whole thing. So that's afterward, and this is after, that's the diamond. So here's another one they cut in the salivary glands right there. Gave them a little mucocele. So we had to start up here. That's where you're supposed to start, right? Halfway between the body of the tongue and the salivary ducts. So start here and then go down. And then we got it to open up without messing up their other stuff. Keep going here. So we see this a lot, like every day almost. This one's really thick. You can imagine how this baby still has trouble lifting the tongue. This is as high as they can lift their tongue up, right? This is an adult, really has a hard time lifting. This is afterward. Notice these real thick lip ties that were not treated. This one they really botched. They cut in the salivary ducts. So again, we had to start up here and go down like that, and then get this diamond to open up. Anyway, so they saw very little improvement after just the clip. No offense to the pediatricians or ENTs, but often they're doing it without, they don't use magnification loops. They're not using a headlamp. They're maybe having one glove on with scissors, clip, and they don't see the patient back. So they don't realize what got better or what didn't get better. So here's a video of how to do it. So we start right at the insertion of the papilla. Go in a circle. I'm putting a lot of tension. So the baby's crying, obviously. We use a numbing jelly, but we're not putting the child to sleep. We don't put any of these kids to sleep. It's like 15 seconds. If you watch someone put a child to sleep, they cry for about 30, 45 seconds. So it's probably about as traumatic as going to sleep, honestly. The parents aren't back there to see it. But for babies, we just take the baby back. Once they get to about a year old, we invite the parents back with them. So now it lifts up much better. It's not restricted anymore. Here's a posterior tongue tie. So you can barely see it, but pull up on it, see it gets tighter. Lots of tension. It's 3 seconds. Ready? 1, 2, 3. Just go horizontally, and it makes that diamond shape. Because what you're doing is you're doing a horizontal cut through a triangular prism, and so you get a diamond shape. That being said, you can screw it up with the laser. So just because you have a laser does not mean you're magically proficient. This one was on Facebook for all to see. Nursing strike. They tried silver nitrate. This is done with the diode laser incorrectly. Went like way wide. I mean, like way too big. Poor baby. But this is what gives people a bad name, like the laser release and stuff. Like that's not a laser release. So laser release is typically like an erbium, CO2, like something like that, non-contact laser. No offense to the diode users out there, but the diode is a hot tip, basically. So it gets to a 700 to 1,000 degrees Celsius and just burns it. The CO2 lasers you saw hovers above it, it just disappears. So it gets to 100 degrees Celsius, the boiling point of water, and just vaporizes. It turns to steam. So we do it, no general anesthesia, no papoose board. Mom and dad are back there holding his hands, have an assistant there, just like this. And here's how we did it. We normally use a tooth chair. I did not use a mouth prop or tooth chair, so it's about 5 seconds. As soon as he realized it was hurting, he bit down and got me. So right there, I got bit. But anyway, for the next video, I got smart to use tooth chair. But this is a few years ago. That was a friend of mine. But yeah, kid did awesome afterward. It's so quick. You don't need to put him to sleep. A filling is much more traumatic. If I had to do a filling on that child on like an ERF or something, way harder than a tongue tie release. Here's another one. This one's actually from a couple weeks ago, I think mid-August. And so this is a 2-year-old. He has lots of trouble. Only has 20, 25 words. I'm not a speech therapist, but that's a speech delay. He has his own language, kind of gibberish. He throws up. He wouldn't do solids. He's a slow eater, spits out food. Lots of issues as a baby. It didn't get better. It didn't grow out. Didn't go away. Sleeps in weird positions, restlessly, wakes up easily, often snores sometimes, and straw gag reflex. So here's his tongue. So his lip is fine, right? He can brush those teeth easily. You didn't have much plaque up there. That's not a problem. But look how tight that is. I mean, it's not to the tip, but it's probably 80%. So we released right here. And then you got a nice diamond shape. Look how much higher he can lift up now. That's incredible. That's way more. So let's see what happened. He came back a week later, or 10 days later, excuse me. 10 days later. So again, this is like just this is not like our best cases. It's not like, oh, here's the best case for the year. This is just a case we saw a couple weeks ago. Less stuttering, less moving in his sleep, sleeping deeper. Used to wake up and join mom in bed. Now he sleeps all night in his own bed. Those of you who are parents, how much would you pay for that, right? Pay anything for that. Chewing better, eating more food, finishing meals better, so it's less frustrating to feed him. He's trying new foods, and this is only within 10 days, so it's real impressive. And we got a video of it. So here's how we did his procedure. Sorry if that's loud. This is that same kid. So we didn't know what improvements we were going to get, but here he is. It's a little bit tight still, so we'll get a little bit more. One more right there. There we go. We're just getting the fascia. Notice he had a good sized vessel under there too. That was like poking through a little bit on the side. So with the laser, you can see that and then just stop. So it's really, you're just doing a nice dissection. There's very minimal to no bleeding. And it's just like a pen. I mean, you're just like making sure you get it all. It's way more precise and delicate than even scissors. So what do we do afterwards? This is also a common question for babies, and I want to make sure we leave time for questions. But for babies, heals by secondary intention. Mom can nurse right away. Tylenol, Motrin, skin to skin. Normally, it's only sore for just a couple of days. Often, it takes 3 weeks to relearn, but they should see some improvement the first couple of days. We always call and check on them. To prevent reattachment, recommend 3 weeks, 4 times a day, really. Quality over quantity. So we show parents before they leave how to do them. Have them put on gloves. That's really the key. Basically, when they lift up all the way, push right on it, firm but gentle pressure. Hold the jaw. I just like one finger down in the floor of the mouth and up like a Heimlich almost, or like ice cream scoop. Otherwise, it will grow back together. And then we see them back at a week because 90% have lost some degree of mobility. For children, like a 2-year-old that's uncooperative, I would not expect parents to do that 5 times a day. 2 times a day is about all you're going to get for 3 weeks. So quality over quantity, minimum once a day. If they're like super uncooperative, autistic teenager, once a day as best you can. Work with a speech or myofunctional therapist. Typically, the exercise is twice a day. Team approach also. So a lot of you guys are on the call. So it's at OT, speech therapist, orthodontist, release provider, ENT, pediatrician, sleep, physical therapist, chiropractor, CST. Hope I hit everyone. Yeah, it's definitely a team effort. Have a few case studies here. So we're going to go from 2 weeks old to 60 years old. So we're going to look at the lifespan and how it changes. Again, I'm not going to run through all these check marks. It'll take forever. A couple of things here. So 2-week-old male, both parents are physicians. One's actually, he's a friend of mine from college. He had a unique last name. They came in and was like, "Are you related to Matt? That's so-and-so." And they're like, "Yeah, that's my husband." I was like, "Oh my gosh, no way." My mom was having terrible pain, hiccups a lot, passy falls out, snoring. Snoring is never normal. From babies to grandparents is not normal. He moves a lot in his sleep. He's always hungry. Lip curls under. He's gassy. Nose sounds congested. Feeding all the time, right? It takes over an hour to feed him. Well, that's a problem. Look at that. Super tight lip tie. And that was to the tip tongue tie. So there's the release. No bleeding. He did perfect. Just like you saw in the video, about 10, 15 seconds for the lip, probably 10 seconds for the tongue. And then, yeah, let's see if they got better. So deeper latch, less falling asleep, more spit up. That one's on there because often if they get more milk, that'll lead to more spit up because they're getting more full. Passy stays in better, which people appreciate. Pain is down from like a 4, like on average. I think it was bad at first, got to a 4, and then a 3 afterward. So it's not like our best patient, like best case. And look, here's a video of it too. So you can watch this one. Yeah, we don't know what's going to improve. This is just, yeah, we took the video, so we had some people there to film it. So back and forth, just lift it up. Just disappears. So we take it all the way to the height of the vestibule. Check it, make sure it looks good. There we go. And here's the tongue. So baby's crying, obviously they're not asleep. This is on a course day, so we had 4 other dentists there with us. So that's why they're filming this. So that's kind of nice. We had some extra people to film it. It just disappears. It's so easy. I mean, why would you not help these kids out like this? It's not difficult. It's way easier than like a class 2 filling. You know what I mean? Filling is way harder than this. There it is. Now the baby can nurse better. Here's a 2-month-old, same day, because we had some dentists there to help me film it. Again, this is August 13th, I guess. So this is not like our best cases. So this one, they have lots of check marks, very difficult to bottle feed. So this is really sad. So Mom stopped breastfeeding. She tried for a couple weeks and couldn't breastfeed. So now she's dried up, no more milk. She wanted to breastfeed really badly, but no one told her there was the tongue tie. Slides off on nipple, gagging, choking, hiccuping, gumming, chewing, passy won't stay in, snoring, airway issues, moving around in sleep a lot. So again, they're not getting that brain development while they're not getting high quality sleep. Lip tie symptoms, right? On this side, so clicking or smacking, colicky, reflux. Colic is terrible, y'all. Like 25% of babies have colic. It is horrible, right? These parents are really struggling if they mark that one. Gassy, milk leaks out, baby's frustrated, have about an hour to eat, take a bottle in an hour, right? Let's look in there. Look how thick that is. No one told this mom about the tongue tie. And no wonder they can't nurse. The baby can't lift their tongue at all. That's really thick. Lip tie is also fairly impressive too. This one did bleed a little bit. Whenever they're thick like that, there's often like a vessel running right in the middle of it. I got a video of this one too. So you can see. Oh, sorry, here's the afterward, and then I'll show you the video. So Wes falling asleep. This is, let's see, this is like a week later. 9, 5.5, now 10, 3.5. So they're up almost a pound like a week later. Less falling asleep, sliding off nipple, less colic, that's a blessing. Less reflux, less clicking, less hiccups, better weight gain, less gassy, less gumming, sleeping longer, less snoring, hello. Snoring, less moving in sleep, so better quality sleep, less frustrated at the breast. Here's the video for it. Same thing over and over. It's kind of like Groundhog Day. Hear the same stories and do the same thing. Make babies mad all day. And just get all the way up. Get that little tag right there. There'll be a tissue tag at the top. Again, 10, 15 seconds for the lip. This one's really thick. So this one's probably 10, 15 seconds too. I don't use a groove director, just lifting up, put a lot of tension. So I use my left index finger and then my right middle finger to lift up and then hold the laser and kind of support it like that. So, because you got to feel it, you got to put tension on it. Look how much higher it is already. We'll get that little piece off the gum ridge there. We'll check it again and make sure it feels smooth under there. Looks good. So it's that quick. Here's a 3-month-old. So getting a little older, it fell off the chart. So the other two were actually gaining okay, notice. This one did have poor weight gain, lots of in utero hiccups. I think that's the earliest sign of a tongue tie because the funky swallow gives them hiccups. So if they're hiccuping a lot in utero, often they have a tongue tie. Mom is triple feeding, so she's nursing, pumping, and then feeding him a bottle. You can only really do that for about a week. It's really difficult. 30, 45 minutes to eat, feels like a full-time job. Baby's frustrated, like all these issues. They're really struggling. They're on the struggle bus if it's that many check marks. Look at that. I mean, it's not to the tip, like right here's to the tip. So it's probably halfway. So that's probably on the line between anterior, posterior, pretty thick down here actually. So we got all that. Again, I don't have video for this one, but very quick. It's the same thing over and over. They gained, again, almost a pound, was 45 minutes before, now 25, 30 minutes, much less snoring, less moving in sleep, improved breast drainage, doesn't prefer one side or the other, less pain, deeper latch, less spit up, less hiccups even. So they'll hiccup in utero. They come out, they're hiccuping like almost every feed often. We'll do the procedure and it goes down like once a day, which is quite more normal. 5-month-old, all the check marks, look which one they don't have. So mom's feeding them all the time. Terrible pain for mom at 5 months old. She's been struggling with 7 out of 10 pain in the first latch on. Lots of in utero hiccups, constant spit up. Mom probably has like a good supply or something. That's why the baby's gaining weight. So look at the lip, pretty impressive, but look at that. So terrible pain. Again, often, not always, right? The first one was bad pain, but it was to the tip. This one, posterior tongue tie, most of the time is bad pain. Yeah, quick, 5 seconds, diamond shape, triangle shape up there. Let's see if they improved. Sure enough, spit up 1 time in the last 2 weeks. It used to be multiple times a day. Sleeping longer, way less hiccups, not making the hiccup thing up. It's just, this is what people are telling us. It was 7, now it's a 3, getting more milk out. She hates it, the stretches, but it's worth it, LOL. And amazing time at the office. So it can make a big difference. Go to now 12-month-old. And 12 months old, still hurts bad 1 year later, 7 out of 10 pain. Every time this mom nurses, I haven't done the math, but that's a lot. Like 8 times a day times 365. That's a lot of terrible pain for mom. No one should put up with that. Spits up every feeding, but again, oh, they're gaining weight. Well, that's fine. Baby's constantly on the boob. That's why they're gaining weight. Snoring, mouth breathing, again, not normal. Short sleeping, all the check marks. Reflux, colic for like a year. That's terrible. Blistered, bleeding, cracked nipples, plugged ducts, engorgement, mastitis, prefers the right side. If we see that one often, that means they need to see a chiropractor. So here's the pictures. Again, they have teeth now, so probably biting mom. That will leave a gap there, so we'll release that. And it can also help with the lip tie symptoms. Look at that. It's nothing obvious. That's why it wasn't picked up. It's a posterior tongue tie, right? Afterward, hurt valid for 12 months. Pain now is a 1. So much less pain, sleeping longer, less snoring, less moving in sleep. So higher quality sleep, deeper latch, improved breast drainage, getting more milk, less nipple distortion and damage. Here's a 1-year-old. She doesn't sleep. Try to weight a blanket. She screams out at night, night terrors, having some airway issues there. Look at all those issues as a baby, ear tubes previously. That's connected as well. Choking or gagging on foods, frustrated communication, really hard to brush her top teeth. Let's see what it looks like. So you can imagine you pull up on that, it's going to hurt. So we release the lip tie, posterior, not obvious tongue tie. So again, if you saw this patient on like a hygiene check, you probably wouldn't even ask about the tongue because it's not to the tip, right? So have a high degree of suspicion. Again, airway issues, look at that. Sleeping deeper, waking up less tired, less sleep with mouth open, less snoring, less gasping for air, much deeper sleep now. She used to wake up every hour. She's sleeping through the night now. I can see her teeth when she's smiling. It's easier to brush. She used to be crabby during the day. Now she's relaxed and ready to play when she wakes up, trying new sounds. Again, she's not that old, but if we get these kids early, that's the key. Got to get them early. 2-year-old male, again, speech, eating, sleeping, sleeps horizontal, hard to brush his top teeth, issues as a baby, single words, he stopped progressing with speech, he's a speech delay. Oh, tongue tie doesn't impact speech delay. It doesn't impact sleep. That's so crazy. These people hand washing used to be very controversial. Back when Ignaz Semmelweis was his name, I can't remember exactly what year it was, but said, we need to wash your hands. That's why these women are getting fever after childbirth, because the doctors would go from room to room delivering babies and never wash their hands, and they were spreading germs. He was thrown in a mental asylum. So I haven't gone crazy yet, but it's like, oh my gosh, how's people not seeing this? For hand washing, it used to be so controversial to wash your hands. So look at this. If you saw this child on a hygiene check, you probably would not even ask, but lifting up on it. So it's not obvious. Lip is fine. If it ain't broke, don't fix it. This is 1 week later. This is not sleeping horizontal anymore. Less in weird positions, waking up less tired, less grinding teeth, less snoring. 2 words now, trying new sounds, says alphabet faster, can talk faster, louder, less packing food, less choking, less strong gag, better attention span, because that's related to sleep. 4-year-old female, again, speech, eating, issues as a baby, went to a few IBCLCs, no one caught it, headaches, Miralax for constipation, lots of sleep issues. I mean, these kids, it's not just like one thing. If they came in with 2 check marks, they wouldn't drive 4 hours to see us if they had 2 check marks. They're coming to see us because they have significant issues. But look, again, probably wouldn't ask anything about this. Looks like every other kid in your chair if you're doing a hygiene check or well child check or as a therapist. So, but look, they can only lift about halfway. It's not obvious, but they can only lift about halfway. So we just release right here. You don't need to do the base of the Eiffel Tower very often. Just right here in the middle, you can see it lift up like that. Beautiful diamond shape, no bleeding, less gasping for air, less snoring, less sleep with mouth open, sleeping deeper, actually sleeping all night now, less headaches, less constipation, feeding much better. If they eat better, if it starts the journey right, it'll end the journey right. They'll poop better. There's a few different reasons. Also, the swallow is related to the strength of the swallow is related to that too. Actually finishing a meal now, just at high quality. 5-year-old, perfect speech, but lots of eating issues, lots of sleep issues. It's like whack-a-mole, sleepwalks, issues as a baby, mouth breathing, ear tubes, lots of ear infections. Again, lip tie is fine. Nothing remarkable about that tongue, but they had all the check marks. So that's why we got to screen for this, right? If you screen for it, then you're like, oh, even though it's not bad, mom says, can this help? Well, let's give it a try. We never guarantee it. It's 10 seconds, minimal risk, potentially high reward. Let's see what we got on this one. Again, these are not like our best cases. This one's, I think, from July. Eating faster, more food, finishing meals better, sleeping better. They had good speech before, so I didn't see any changes, but lots of good changes. 13-year-old, everyone says, what did you say? Or speak up. Dad understands about 70% of what he says at 13. Can't do steak. Often it is meat and mashed potatoes they have trouble with. Had some cavities. had terrible constipation, had to go to the hospital for a few days because his constipation was so bad. Hyperactivity, ADD, on meds for it, reflux, sleeps restlessly. So he's a terrible sleeper, right? Grinds his teeth, wakes up tired, not refreshed. There's nothing there. Let me get these marks off. There is nothing there. His lip is fine. He fell and ripped it a little bit. That's not our treatment of choice, but sometimes they do fall and rip it. Look, he can lift his tongue up well. He can lift all the way to the top, but he had lots of check marks. Hey, mom, let's give it a try. Probably 15 seconds under there. We sutured it up. If they're adolescents or adults, we'll suture it. 6 is probably the youngest we can realistically suture, but normally we want to suture if they're older. He's talking better. It's like a week later, right? Not like, this is not a year later. It's not like, oh, he just got better because he's 14 now. No, this is a week later. Hit a burger faster after 13 years. Less frustration, eating more food, finishing meals better, less moving and sleep, sleeping deeper, waking up less tired, less grinding teeth, talking better. Finally, the 60-year-old. So we made it. Skipping a few decades there from 14 to 60. But anyway, trouble with sounds. This is a myofunctional therapist, speech therapist. She's been working on tongue posture. So she's seen some sleep improvements, even with myo, which is in the literature, Camacho 2015. AHI decreases 50% in adults, 62% in kids with myofunctional therapy. But if you combine that with the tongue tie release, they can actually get the tongue up all the way. You'll see even better results. Neck tension, TMJ issues, reflux, lots of eating issues, lots of stuff. Feel like food stuck in the back of my throat, saliva pools under my tongue. The front of the tongue touches the palate, but the back doesn't. Panic attacks, seeing a chiropractor for issues. But yeah, she's had some issues realizing she needs to put her tongue up. So let's look at it and see how bad it is. It's probably terrible, right? There's like nothing there. But she had lots of check marks. Hey, it's worth a try. We can try it. So like, you set low expectations and then under promise to over deliver. It was probably, 30 seconds or so to get that. We take our time on the adults because look at all this. There's lots of veins under there. You don't want to mess with that. Sutured it closed. She's sitting there. I'm like, if you want to do your lip tattoo, we can. I won't charge anything just for fun because hers is like not there. There is nothing there, right? So we released hers. She said, I can breathe through my nose. This is so crazy. She said, I can breathe through my nose. This is the email she sent me a week later. So again, this is not like our best cases. This just happened like a couple weeks ago. Just showing you some real new cases. I can breathe through my nose finally. After practicing a correct swallow for 5 years, I can finally swallow correctly without thinking about it. No pain. Sleep better without any snoring or whistling noise in my nose. Stand up straighter. No pain in my neck, head or jaw. No afternoon slump. She has more energy because she's sleeping better. No low back pain. So grateful and thankful to God and experience the benefits. Thank you, Dr. Baxter. Healing nicely. There's your lip. Not making this up. So we made it. Proper assessment and evaluation is critical. Symptoms and function are more important than appearance. Common does not mean normal. Screening should be conducted at hygiene visits. The sooner it's addressed, the more team members, the better. Does change. They don't get better. It just changes over a lifetime. And it places significant limitations on a patient and family's quality of life. So if you guys want to, you can download our forms. You can contact us. We have a code for Tongue Tied Academy. Just use the code Facebook. It'll save you $200 on Tongue Tied Academy. And then it'll save you some money on the light version too, if you want the light version. So I have a few minutes for questions.
Yay!
Here's the article for the lip tie stuff. The gap closes up like every time. But anyway,
Wow.
It closes up. I didn't have time to show that. But yeah, anyway.
This is fantastic. What a wonderful presentation. Oh my gosh. I know that we could stay here 2 more hours just asking you questions.
I know.
We love it. We want to learn it all.
I got more patience now in like 5 minutes. So
okay, so let's just ask a couple questions.
Yeah, whatever y'all have.
And I'm going to let you go because Anne, you have great questions. I'm just going to go ahead and let Anne. I saw she posted some. Go ahead, girl.
Okay, thank you. That was a really incredible presentation. I know you flew through that, but you covered everything. So thank you very much.
Yeah, I had 1 hour.
Okay, I'll make it fast. My question is, experientially, what have you seen with the addition of body work towards increasing functioning post-op in the patients you've worked with? And let me add a second part to that. If a patient was financially strapped and the choice was myofunctional therapy or body work, what would you advise?
Oh, that's hard.
Yeah,
So Like basically, bodywork's critical. We tell everyone minimum see a chiropractor. In our area, there's only one CST. There's not really like any osteopaths here, so there's lots of like chiropractors, and a lot of them have like a pediatric certification from like ICPA or something. So we tell everyone to see a chiropractor, ideally before, but a lot of them are coming from several hours away, or I'm not sure how they heard about us, but they think it's kind of hokey. So I go into the chiropractic bodywork piece with everyone. If it's like a 2-year-old, there's like baby myo stuff, but really like bodywork would be more effective than myofunctional therapy there. If they're older, ideally it would be myofunctional therapy is probably more important, but it's hard to say. It's like, what's more important, the tongue or the lip? Like, well, the tongue is typically more important. The lip can contribute too. So that's a hard question. You really need both, but a lot of our patients are on Medicaid. They don't have enough money. They can barely have enough money for the release. So we will give out some myofunctional exercises to like a 7-year-old or something if they don't have the money. And there's only one myofunctional therapist in our state too. So it's hard. You just got to do the best you can with where you are and what resources you have and the family has. So there's ideal treatment, and then there's like real world treatment. So try to balance that.
Thank you.
Ruth.
Thanks so much.
Ruth, do you want to ask a question real quick? Because I know you have to go too.
Yeah, I do. But Lindsay just asked a question specifically about Alabama. So she wants to know, and someone asked earlier how to find quality providers. So do you have any suggestions on how to find someone that is qualified? And I know we're not an IR in Savannah, and it's hard too, but
yeah, I mean, our average patient drives 2 to 4 hours. So I have a chiropractor actually coming. She's probably here right now from Dothan area. That's coming up to watch us do it this afternoon. So we do have some people come shadow if you're local and want to come shadow. We have like a course for dentists. There's a charge for it. We're going to donate it, but there's 4 dentists at a time. But like for local people that want to come see, just like for an afternoon or something, we do have it available sometimes. But yeah, it's hard. There's unfortunately we don't see the best high quality releases. And typically it's like an ENT. So like this morning, the mom said, oh, we went to an ENT. They wanted to put the baby to sleep. It was an old guy and he wanted to cut it. And mom's like, I was not okay with that. And so, and then another one said they want, sorry, that was the same one. They said that it was going to be probably a couple $1,000s after the anesthesia fee, the CRNA, the anesthesiologist, the facility fee, the ENT fee, but they were in network, right? So we're considered out of network, but our fees it's less than $1,000. And then for just one, it's $500.
Guys, I know we have so many questions and they're amazing questions. Maybe we'll have Dr. Baxter come back in a day for a Q&A.
I'll answer these ones on the side on the chat here real fast. Which were clipped and snipped. Basically, if it's thick or not, you can tell if it's been clipped before. Most effective method to find a quality provider. Often the best way is the Facebook groups, unfortunately, is probably the best option. It's like every state has like a tongue tie support group. Go on there and then you'll get real information from moms, or check Google reviews. You can check our Google reviews, check the reviews of whoever you're going to use. And if they do a lot of them, they should get some Google reviews from parents that have had it done. Is there familial ties? Very often it's dad's fault. It's a running joke we have here. I give it to all 3 of my girls. Most of the time it's dad's. Occasionally it's mom's. But you guys out there, you know everything is dad's fault anyway. So whatever happens, it's always dad's fault. Why do we suture? Because they'll let us. If the baby would sit there still, I mean, it might be helpful to suture it. They dissolve. But honestly, you're only really saving a few days on the stretches. It seems like it's less likely to grow back, meaning we don't have to do a deeper stretch. So if I massage it and it stretches out a little bit on a baby, they'll cry, but they cry anyway when you change your diaper and stuff. So it's not terrible. If you push down and stretch open in adults, they will like whack you. It does not feel good. And so we'll suture. It seems to protect against having to do a deeper stretch. It also, I saw like an article, something on the Airway Circle about like, I saw someone asked a question about the serapeptase and like, how do you minimize scarring? That's the $1 million question. I wish we could minimize scarring. I think probably suturing at primary closure will probably get better healing. Dr. Zaghi, I know, is a big advocate of that. So after taking the Breathe course last year, I have been suturing more. If they'll let me, we'll suture. We do charge more because it takes a lot longer. So instead of 15 seconds, it's like 10 minutes. We don't charge like 10 times more. We charge double if we have to suture. But yeah, I think it helps. So if they're asleep and I'm fixing like all their teeth, like crowns, and they're asleep and I do their tongue tie, I'll suture it. Because the reason we got there in the first place is probably a compliance issue from not brushing the teeth or something. But if it's like a 2-year-old, I'm not going to put them to sleep just to get sutures. So hopefully that helps answer.
Yes, definitely. And your course, is that only for dentists or is it for all providers?
Yeah. The online course is honestly probably the best way to go. So it's 13 hours of material. There's like 65 case studies. So I just went through about 10 there. We go through the A to Z of tongue ties. We've had a lot of people take it that have been real impressed with it or something. We had hundreds of people take it. The full version is $2,500. Basically, it's for dentists. The therapist version is about $500. If you use the coupon code Facebook, I think there's like a light 2021 or something. Just email us if you want the code. I think just the code Facebook should work too, and give money off of the light version as well.
Sure. Oh my goodness. Thank you so much. This has been a wonderful presentation. Thanks everybody who attended. We had about 30 people on Facebook Live and about 20 here. So thank you guys so much. This has been wonderful. Dr. Baxter, you are a wealth of knowledge. Thanks for taking time out of your busy day to be here with us. We really appreciate this. I know so many people are so happy that you shared so much today. This has been wonderful. Guys, this week on Tuesday, we have Charles back. We have on Thursday a special for dental hygienists who want to get into myofunctional therapy. We're going to be talking to you guys about that. And on Friday, we have Michelle Chatham. So thank you so much, Dr. Baxter. You have a wonderful week. We'll see you guys later.
See you guys.
Bye-bye.
Bye-bye.